Could you imagine walking into a doctor's office, no computers, bunch of cards, bunch of paperwork floating around? When you make an appointment, you have to fill it out, and it's sat with a bunch of other papers with other lists of other appointments. Well, I'm old enough to remember having to do things like that. It was not very practical. That is why I would like to talk about the importance of information technology in healthcare. Federal government currently is trying to expand the use of information technology in healthcare. There are a lot of people that are currently dissatisfied with the current level of healthcare that they're providing. What needs to happen is that this needs to be addressed before healthcare can get to its full potential. What is the full potential of healthcare? Well, first, there is obviously improving the quality of your healthcare. Now, information technology improves that by what? Streamlining everything, streamlining your appointments. When you go see another doctor, they have the information that is already set up by a previous doctor. It's already in there. It already improves the quality. The health of the individuals, obviously, if the quality improves, the health is going to improve. Cost savings. If it saves time, it saves money. And greater engagement by patients in their own health. And that is what it is all about. The intermingling of information technology in the healthcare system has always helped alleviate some of the adverse drug events. When things are sitting to the computer, they're checked, rechecked, and double checked. It's made everything more efficient. And there's nothing worse than getting the wrong prescription. Trust me, I've had that. There are legislation that has been designed to spur the adoption of these things. Anything that would be adoptive, it would already have to have an in-place information technology infrastructure. And with all these things in place, oddly, adoption was pretty slow. Thankfully, in the last 4 years, they've seen a rapid growth in the adoption of information technology. Actually, the growth was so drastic, it was greater in the last 4 years than it was in the previous 20. Now, there's something to be said for that. Now, as we go on and we start to upgrade our information technology in the different hospitals, you have to make sure that the technological divide does not greaten. And I say that because there are still some hospitals and medical places that have not adopted certain information technology things. So the ability to communicate with places that have advanced technology makes it a little bit more difficult. So that is why you have to watch how big the divide is. As far as accessibility is huge. Well, if you have your health records accessible, then you're more likely to review your records. When you review your records, then it makes you more accountable to your own health. And that is what we want. I'd like to know what's going on. You know, the last thing I can stand is when I go to a doctor and they try to tell me what's wrong with me and I have no idea what they're talking about. This way, I'm able to review my records and then walk in with some kind of knowledge about what I need to ask. In conclusion, information technology in healthcare can only help. It can't hurt. It's cheaper. It makes the quality of your stay and of your treatment much better. And also, more interaction. And like I said, that's what it's all about. More interaction, more accountability, and being more involved in your healthcare. Thank you for listening.